late, and so we'll officially start at about 8:45.
Okay. Then I will see if, good morning, Josh.
Morning.
See if Anne, if we can kind of start and.
Yeah, if we start, do we just want to then go into recess?
Yes. Yeah, we will till 8:45.
Okay.
I just need to make sure Anne can start the recording.
We are live right now.
Okay, thank you very much. So good morning. It is 8:32. We were scheduled to start our meeting today at 8:30 for the special Board of Health meeting for our interviews for the new Board of Health members. It is February 1st, 2022. Again, it is at 8:32. We do know that a couple of our panelists are not able to join until about 8:45, so we are going to recess for the next, 12, 13 minutes to let that happen. And so we will be back on at 8:45 and do roll call. Thank you. Okay, it is 8:45. At least on one of my computers, it says 8:45 screen. So we will go ahead and reconvene. Hopefully Commissioner French will join us here shortly. So we'll hold off on roll call for a few minutes, but we can kind of get our housekeeping items out of the way. So again, I just want to thank everyone who has applied and is taking part in the interviews yesterday and today. It's a lot of work, I know, from everybody's perspective, and we truly appreciate your ability to want to serve on our health board, and look forward to making these decisions hopefully later on today. That again, the process is that the decisions that are made by the panel will then be moved forward to the Board of County Commissioners for final appointment. So just so everyone knows that, and we hope to make, as a panel, the decision today. But, as we learned yesterday, you never know what happens. And so we will see what happens when we finish the round of interviews today. Michelle, we did talk about, that we are following, maybe I will have you just restate today what you stated yesterday.
Sure.
Since we have the time.
So what we're doing as far as the process is to follow the proposed rules that have been developed by the Washington State Board of Health, the proposed WACs that are implementing the Senate Bill 1152. And those set of rules indicate that the local Board of Health recruits, interviews in a panel format, and then refers successful candidates to the Board of County Commissioners. And that's in part because the House Bill 1152 specifically requires that the non-elected members of the local Board of Health are appointed by a majority vote of the Board of County Commissioners. So we interview and make a selection here, which is then referred to the Board of County Commissioners for final approval and appointment.
Very good. Thank you. So our first candidate will be at 9 o'clock today. Look, make sure I'm looking at my right list. So we have a few more minutes. We put in plenty of time here, and so just to make sure we knew the process. But I do want to just say we are taking today's interviews just for timing for the candidates. They're not all grouped together. So I just want to make sure that as we move forward, I will make sure that I identify which area that interview candidate is being interviewed for. Because today we're doing the consumer of public health interviews and the community stakeholder interviews. So with that, I just want to make sure that I will be making sure that I announce which area that they're kind of which bucket, I'm just going to say, they're being interviewed for. And those will start at 9 o'clock. I don't think we really have anything else, Michelle, until, we've got roll call right before 9. So.
Chair Cuny?
Yes.
Could you, when we go in, I know you're going to have the interviews kind of distributed because of timings for the interviews, but could you identify for the buckets, for the who we interviewed yesterday, who is also being considered in those buckets when we go into that process at 9 o'clock? Just so that folks know that we do have some candidates that will not be interviewed today, but we're also being considered for those positions or for that role.
Yes, I will do that.
Thank you.
So at this point, we'll just stand by till probably about 5 minutes before 9, and hope that Commissioner French is able to join us at that point. Otherwise, we will start interviews at 9 o'clock.
The commissioner has indicated he's on his way.
Okay. Thank you. Okay, I'm going to go ahead and get started. We'll do roll call in just a few minutes, hoping that Commissioner French will be there. But I do just want to state, to speak to what Mayor Freeman had stated, is that we do have today we'll be taking interviews for the community stakeholder interviews. And so we do have 2 candidates that we'll be interviewing today. But we do also have 2 candidates from yesterday that are being considered as part of this discussion. So Dr. Denise Smart and Dr. Daniel Repsol, part of, got an echo going, part of the community stakeholders. So there are 4 candidates that we will be looking at. Dr. Denise Smart and Dr. Daniel Repsol were interviewed yesterday. And then we will have the 2 other candidates interviewed today. With that, again, in the procedures, I will be reading the questions, or if I need to, I will have Michelle Fossum, our attorney, read the questions. They are the same 10 questions that were asked yesterday. They will be the same 10 questions today asked by all the candidates. So with that, I see Commissioner French is on, so I will ask Ann to do roll call. Ann, can you take roll call?
I apologize for the delay. I was on the phone with the first candidate, making sure they were connecting properly. So for roll call, Mayor Kevin Freeman,
Present.
Commissioner Al French,
Present.
Commissioner Josh Kearns,
Here.
and Commissioner Mary Cooney.
Present.
We have a
Thank
quorum.
you. Okay, thank you very much. I appreciate that. With that, like I said, we will be starting off with the first candidate will be Chris Patterson, who is in the area of consumer of public health. So as a consumer of public health, we will interview Chris Patterson at 9 o'clock, and then we'll have the other two candidates later at around 10:25. We'll have the other two candidates for the consumer of public health. And I'm just going to say, fuck it. So with that, it is almost 9 o'clock. So we will just get ready to bring Chris Patterson in when he's available. See, Mr. Patterson, I see you're there. I don't know if you have audio or video or just audio today. There we go. Mr. Patterson, thank you very much for joining us today. We appreciate your taking the time to fill out the application and to, oh, I don't know if you can hear us yet.
It's coming through. It's a little slow.
Okay, there we go. Okay. So, Mr. Patterson, I want to say thank you very much for taking the time to fill out the application and being here for the interviews. Thank you for adjusting your schedule. I know we had to do a schedule change, so we appreciate that effort. So just so you know, I will be asking the questions. We have 10 questions. They're the same 10 questions that we asked everyone yesterday, and we'll be asking the same of everyone today. So you have 25 minutes, so it goes fairly quickly, and we want to make sure that we leave time. Our 10th question is if you have any questions or concerns for us. So we'll start with question number 1. What is the role of the Spokane Regional Health District in our community, and what is your role as a board member, and why do you want to be a board member?
The role of the Spokane Regional Health District, in my opinion, is to keep a balance and keep the perspective overall on what's happening in Spokane County and surrounding areas, for whether it might be health disparities, a lot of the social issues. There's obviously sewer issues, septic systems, a lot of the things for developments, swimming pools, a lot of the things in the parks. And I think the biggest thing is in my role would be to be more of a listening piece, balancing point of view to where you look at all perspectives and try to bring a balanced perspective on what's there so you can actually impact everybody in a fair and, I would say, rational way.
And the second part of that question is, why do you want to be a member of the board?
I think servant leadership and public service is an honor to do. And I think myself, giving back to the community that you reside in is probably one of the best things that a person can actually provide. Sitting on the sidelines is not something I prefer to do. And I think getting involved in things is more of a healthy approach, from my opinion.
Thank you. Question number 2 is, what expertise, diversity, and life experiences do you bring to the board that will be beneficial to representing our community?
Well, having been born and raised in this area and also have grown up in the foster care system, I'm intimately knowledgeable about the systems, that maybe there's shortcomings, maybe there's strengths, maybe there's assets that people are aware of or they are not aware of. My experiences working in the field of health and human services for the last 25 plus years, as well as working for the U.S. Department of Housing and Urban Development across different parts of the country, has given me a view of things that maybe we can do different, maybe we can do better, maybe things that we are doing already better. We just need to amplify it and make sure that those things that are being addressed are looking at it from a bigger lens. Spokane is a large, compassionate group of people, and there's a lot of heart here to help the community itself, and I think just building on that is what's important to me.
Thank you. Question number 3 is, what is your definition of public health, and why do you feel public health is important to our community?
My definition of public health is looking at the entire system from a whole to see where maybe there's deficiencies, disparities, where we can improve systems, where we can enhance systems, where we can look at the bigger approach to affect all communities surrounding. And I think it's something that's pretty valuable to make sure we do it the correct way.
Question number 4 is, other than the COVID-19 pandemic, identify with specificity 3 significant current public health issues and 3 future public health issues facing Spokane County.
Homelessness, mental health, addiction, fentanyl. I mean, I have a pretty long list. And I would say it's probably the same thing for the second question for the future, because until we deal with the issues of the drugs, the mental health addiction, the addiction itself, the co-occurring disorders, we're not really going to move the dial until we start addressing those issues.
Question number 5, describe your experience and philosophy as it relates to the board's responsibility for governance of the health district, including interactions with the Spokane Regional Health District Administrative Officer, financial oversight, and decision-making when faced with differing viewpoints from fellow board members, staff, health professionals, and the public. I know that's a big question, so if you want me to break it up.
You might have to repeat some of those. I would say differing opinions is healthy. I like when somebody actually has the challenge. I think that there's a healthy debate on things that maybe we don't see from another person's perspective. I think coming from my point of view, when I look at how the systems approach for health and human services, how one parent might parent a child different than another, and then coming from that systems approach where I came from the system, I look at where the pitfalls are and how you can work with individuals, and the differences is a strength in my opinion, because you can have opposing forces and find middle ground in the least expecting places you really didn't expect. And I would, whoever I work with would be, I have no issue with working anybody. I think there's going to be a need for strong relationships with individuals. There's going to obviously have differing opinions at times. But at the end of the day, if you can find a way to come to the middle and get things done, that's the biggest approach. And I think it's where it's most successful to affect all people in the community and surrounding area.
Question number 6, how would you respond should your personal beliefs conflict with directives from the federal, state, or local government?
My personal beliefs is at core who I am. I stand to the testament of I'm proud of who I am and what I stand for. Those are things that will not change. It does, in fact, sway my opinion at times where you can look at one person's view versus another. I think at the end of the day, if I can find something, again, where there's common ground, I'm not willing to sacrifice on my personal convictions. But my personal convictions aren't the one at the table. They're the impacts of the actual community is what's important.
Question number 7, do you have any potential conflicts of interest, such as contracts with the health district, close relationships with an employee of the health district, or a financial interest in rendering of health services in Spokane County?
None of the above.
Question number 8, The Board of Health meets for 2 hours, meets monthly for 2 hours, and there's also committee work that can take 2 to 4 hours per month. Do you have the time and flexibility to take on this responsibility in a consistent and prepared manner?
Yes, I do.
And so the last question, you've just gone through these, is do you have any questions for the panel, or do you want to expand on any of the questions that your answers to the questions above?
No, I think the questions you're asking, if it was me, I would be asking what you all specifically are looking for. But I think the questions you have asked me are pretty much probably coming from you all in the first place.
They are. We all put questions into Michelle, our attorney, and she culled them for us and came up with the list that we thought we could make happen in the 25-minute time frame. So they are the questions that we wanted to make sure we were asking. So thank you. Do you have any questions for us that you'd like to
Looks like
ask?
Michelle's raising her hand.
I am. I think, Madam Chair, that we inadvertently skipped the question that Commissioner French added yesterday. So I think we should
did
add that one in.
Thank you for catching me on that. Sorry about that. So we do have a ninth question. So please give us your opinion as it relates to naturopath or alternative approaches to community health.
I think it's an individual's choice. I think that you can go back in history and in time, and you can see there's balances of whether it's acupuncture, naturopath, or whatever it might be. And if that individual, those families believe it's valuable to their family, then I see no issue with it.
Thank you. Thank you, Michelle, for catching me. I'm out of practice from yesterday, I guess. So then, Mr. Patterson, is there any other questions that you have for us that you would like to know?
Nothing I can think of right now.
Okay. Thank you very much. We appreciate, again, you taking the time and arranging your schedule to have the interview. And we are going to be then done a little bit early, so we may take a little break and wait for our next candidate to join us. So
All right.
thank you very much. And I do want to state for the record that we are interviewing you as a consumer of public health, and that's the bucket that we have you in as we look to interview the other candidates. So thank you very much for applying.
Thank you. You guys have a good day.
You too. So our next interview is at 9:25. So, Michelle, I'm just gonna, I guess, we have.
I think it makes the most sense to just wait until the scheduled time and then have that person join us. So we stay on schedule.
Okay. Perfect. So then we have almost 15 minutes. No, 10. Yeah. 9:25, 9:10. So I think we will take a quick recess then, and we'll come back just a few minutes before, I would say let's try to be back on at 9:23. I'll try to put my phone on or camera on and get everybody back so that way we're ready to go for the 9:25 interview. Thank you. Okay, it's 9:23, just turned 9:24. So I'll have everyone come back on for our next interview. So the next interview is going to be for the bucket of community stakeholder. And again, we have 4 candidates in that bucket. From yesterday, we have Dr. Denise Smart, Dr. Daniel Resvold, who we interviewed yesterday, and today we'll be interviewing 2 other candidates. So, and I apologize that candidate number 1, I am not sure how to pronounce the last name, so I'll ask the gentleman as soon as he arrives to make sure I don't say it wrong to start with. Good morning, Charlie. Charlie, can you pronounce your last name? So I don't want to say it wrong and have it start to get wrong. So could you state your last name for us?
Yeah. Can you guys hear me good though?
Yes.
Awesome. So it's the easy version is Duranona.
Duranona.
That's the easy version. Yeah.
Okay. And what is the hard version?
The difficult version would be Durañona.
Okay. Yeah.
Yeah. So let's go with Duranona.
Okay. Very good. Thank you very much.
Yes. Thank you.
So,
nice seeing you all.
So Mr. Duranona is very nice. Thank you very much for participating today. We want to thank you for filling out the application and joining us. So before we get started, I just want to let you know that we have 10 questions. They're the same 10 questions that we've been asking every candidate we asked yesterday and asking everyone today. With that, we have 25 minutes. So depending on how quickly or long it goes, we'll let you know kind of timing. So, and I'll be asking all 10 questions just so that way we can, keep moving along with the process. Okay. But, do know that we've got Mayor Freeman and Commissioner Josh Kearns and Commissioner French are all on the panel watching. And then our attorney for the Health District, Michelle Fossum. So, okay, I'm going to start with question number 1. What is the role of Spokane Regional Health District in our community, and what is your role as a board member? And why do you want to be a member of the board?
All right. So in my opinion, I believe the Spokane Regional Health District is the front line, basically the front line in ensuring the health of the public. I believe the big 3, right? Promote, prevent, protect. When I was a veteran service officer for the military order of the Purple Heart, my little cubicle was stationed actually in the 4th floor in Spokane County Veteran Services, County Services, when it was up on the 4th floor there. And I was able to see all the really cool programs that the health district has, from food safety and food handling to environmental, which includes like air and water, sewer, pools. I always thought it was just infectious diseases that it was taking care of there, but it's an array of different programs, from maternal and child health, which includes WIC, emergency preparation. It's just immunizations, everything in that nature. Even when it comes down to education, a really good program when it comes down to health educators and health communicators. And I believe also the Spokane Regional Health District assures access to healthcare to members of the community that probably otherwise wouldn't have that healthcare. Role of the board, I believe it's a governing body. So I believe it's to bring up and uphold policies that help improve the health of Spokane overall in the county. Comes up with creative ways to bring about better access to different programs and different educations. I want to be on the board because I believe that I could bring a different perspective to the board with my extensive experience of, being in the medical field for almost 14 years. I both military and civilian. Being a minority in the region, being a disabled veteran in the region, working with homeless veterans and homeless individuals experiencing homelessness every single day. allows me to, I believe, bring that voice to the table.
Thank you. Question number 2 is, what expertise, diversity, and life experiences do you bring to the board that will be beneficial to representing our community?
Well, starting off with, 14 years being in the medical field. I'm not a doctor or nurse. I was, from 2001 to 2007, I was a Navy corpsman, Marine Corps medic. So I learned everything there is to know about medical that I know of through that. And then out in the civilian world, working for almost every single specialty out there. I believe that is an expertise that I have. I am the big one. I'm a Hispanic male, married to a biracial female, father to a multiracial daughter, born and raised in a pot of a huge city like Miami, and able to travel the world. I believe that I could bring that different perspective view to the actual board. Being a disabled veteran and knowing all the different issues that come with veterans, issues, PTSD, mental health, addiction, care in the community, I believe is another thing that I could bring to the table. I work with homeless veterans every single day. So walking out there, and my job is to walk the street and go to those areas that a lot of people don't really want to go to, and look for homeless veterans and get them off the streets, and try to help them. So bringing that to the board and showing, how we can actually provide better access to healthcare for those who are experiencing homelessness or low income. So all of that, I believe I can bring to the table.
Thank you. Question number 3 is, what is your definition of public health, and why do you feel public health is important to our community?
Well, by definition, public health, it's the science of protecting and improving the quality of the city. But what I see it is where doctors treat the individual person, public health tries to prevent people and the community from getting sick in the first place. Putting programs out there like smoking cessation, better food for our kids in school, stuff in that nature. I believe that public health is important because the research, the data, the programs, the education, everything that comes from it saves lives, keeps Spokane's healthy. So I believe that's, so there you go.
Thank you. Question number 4, other than the COVID-19 pandemic, identify with specificity 3 significant current public health issues and 3 future public health issues facing Spokane County.
Specificity. I can't even say that word. Good job.
I can't either. I messed it up yesterday. Don't worry.
Well, working every single day with mental health counselors, social workers, psychologists, my number one thing, and the one that I'm very passionate on, and the one that I'm always going to be champion if I get on this board, is going to be mental health, suicide prevention. I believe that we can do a lot better as a city when it comes down to this issue. Anybody who has not been touched by suicide in their life, I consider to be an extremely lucky individual. As a veteran, we all know the crisis that of suicide in our population, and unfortunately, I have lost a couple, and I've been touched by other ones that have lost as well. I think mental health is one of the biggest things that I see out there when I walk the streets looking for homeless veterans. Access to good quality mental health, community mental health, the wait lists, the burnout rates, and the education. We have 7 schools in the area, somewhere in that nature. and about maybe 2 to 3 programs when it comes down to mental health issues, 2 mental health programs, 1 social work program. And if anybody wants to become a psychologist around here, they have the closest places an hour and a half south to Pullman. So I believe that a lot of things can be done when it comes down to that. And I'm sorry, I could talk all day about mental health and suicide prevention, so let's move on. The second one would probably be the opioid crisis. I know that I have an extremely good friend who lost her sibling to this crisis. I myself, my cousin who grew up as brothers, has been dealing with this problem since he was in his 30s. He's lucky enough that he's actually in a long-term rehab facility in Seattle now to take care of that issue. But a lot of people are not that lucky, especially those that don't have access to it. Number 3, poverty, homelessness, access to quality healthcare. Walking the streets out there, you can't. There's not that people can't get to a clinic. They don't have a ride. If I don't go out there and give them a bus pass, they can't get out there. If I can pick up a veteran, they don't get to the VA or wherever the clinic. So I believe those 3 are big issues that are current and will continue in the future as well.
Thank you. So question number 5 is describe your experience and philosophy as it relates to the board's responsibility for governance of the health district, including interactions with the SRHD administrative officer, financial oversight, and decision-making when faced with differing viewpoints from fellow board members, staff, health professionals, and the public. Okay. A big question, so if you want me to repeat or not, I'm happy.
I think I get the gist of the question, and I believe best way of looking at it is look, we're not always going to agree on things, but knowing that when we come to the table, we are all coming from a place in where we are trying to make Spokane a better place, whether that's coming from one side or coming from the other side, wherever the case may be. As long as we open up communication and discuss about things, that's how we're going to get things done. Just like a relationship, right? Communication is the key to make it happen. I believe the same way here. Had getting pressure and stuff from, was that the question? The pressure of people telling you?
It's part of it. That's okay. The latter part is the decision making when faced with differing viewpoints from fellow board members, staff, health professionals, and the public. Right.
Yeah. Basically, we're just we come from different experiences in life, professionally, life experience, professional experience, and we're all gonna have different views. And like I said, we come to the table open-minded, talk about it, communicate, have a great discussion, knowing that we're all together there to make Spokane a better place. And I think that we can get a lot of things done if we come with that mentality.
Thank you. Question number 6 is, how will you respond should your personal beliefs conflict with directives? Sorry, I'm going to start again. Question 6, how will you respond should your personal beliefs conflict with directives from the federal, state, or local government?
Well, the military guy in me tells me that, if it's a federal law or if it's a state law, of course, we're going to have to follow that law. When it comes down to local, we have a little bit more say in what we can put there. Excuse me. That doesn't mean that we can do things or try to do things to convey our opinion to see if we can do any kind of change to the state law or something where it doesn't apply to local. But I will always listen to the professionals when it comes down to doctors, physician assistants, lawyers. I will always listen to the professionals, get their feedback, and then I will, if I'm part of the board, I will put out what I believe is right from listening to all the professionals. And if it's something that passes that goes against it, my personal beliefs, I've worked in the House of Representatives for 3 years, so I know how to deal with. I know how to put it to the side and then just continue on advocating my point of view to see if I can relay it to you guys and let you know, hey, this is how I feel, and just continue to fight for what I believe. But overall, we have to remember that this is a whole collection of us together making Spokane better. So we have to negotiate and compromise and talk to each other.
Thank you. Question number 7. Do you have any potential conflicts of interest, such as contracts with the health district, close relationships with an employee of the health district, or a financial interest in the rendering of health services in Spokane County?
Nope. No, I do not. Short answer, because all my other answers have been very long. So no.
No, you're doing just fine on time. So the next question I have is, the Board of Health meets monthly for 2 hours, and there's also committee work that can take 2 to 4 hours per month. Do you have the time and flexibility to take on this responsibility in a consistent and prepared manner?
I do. I'm lucky enough to have a job in where I have, flexibility and PTO and stuff in that nature if needed. So yes, I am available whenever is needed.
Thank you. Question number 9. Please give us your opinion as it relates to naturopath or alternative approaches to community health.
Okay. Love this question because honestly, I don't see any issue whatsoever. Okay. I have a chiropractor. I love my chiropractor. I have a massage therapist at the same time, even though my neurologist friends would tell me otherwise. I believe that naturopathic medicine and alternative medicine, Eastern medicine, have been around a lot longer than Western medicine, and it's worked. My great-grandmother was one of the last Taino shaman women. Taino is indigenous Caribbean people. And every time I was sick when I was a kid, I would tell my grandmother, hey, I'm sick, and tell her the symptoms. She goes and makes some kind of crazy herb tea mix and give it to me, and I was good to go. So, I mean, to me, I believe it works. I believe it's needed, and I believe that having a different perspective of, preventing the medicine and treating the person before we get sick, instead of treating the person when they get sick, and looking at it more of a holistic approach, I think works. And I think that combined between that, and I don't understand why both can't exist. And there's been that huge battle the whole time of the, if you do this, we can't do that. I believe that both work at the same time. So I'm a huge thumbs up guy for it. Absolutely, 100%.
Thank you. So question number 10 is basically just if you have any questions for the panel, or if you would like to go back, we have, I think about 8 minutes to left. So if you would like to go back to any of the questions too that you'd like to answer further.
So one question I have for you guys is, with how today's atmosphere is, how do you guys deal with, if you do something and the negativity comes at you in one way, because if you're going to do something, one person's going to get mad. If you do another one, the other person's going to get mad. So how do you guys deal with it? And how do you keep the morale up in the board in this environment?
That's a very good question. Would anyone like to take that? Mayor Freeman? Josh, I see both of you on video.
But I'll jump in. I think the most important thing is stay true to yourself. I mean, if you know deep down the decision you're making is the right decision, I think that's important. If you're on this board as an elected official, or if you're on this board as an appointed official, you're there because people saw something in you. There's something that the people thought you had in you or saw in you that you would be able to do the work that this board entails. But looking at all angles and making the most educated decision that you can. But if you know deep down you're making the right decision, that makes it a lot easier to kind of take some of the negativity that can come with decisions if some people aren't happy.
Got it. Thank you, Commissioner.
Mr. French?
Yeah, I think we're in unique times because we not only have a pandemic that we've never seen to this extent before in our history, and that is creating exhaustion, tension, apprehension, distrust, a whole lot of emotions. In addition to the impacts of the pandemic itself. So, especially in the medical community, they are exhausted from trying to treat and keep us vertical and on the green side of grass. And to be, my heart and prayers go out to them for all the work they're doing. So, but then you couple that with some of the challenges we've recently had to deal with the health district. And, that's probably most frustrating because state law created by people other than us defines how we can communicate with the community, and individuals have certain rights that you have to respect as you go through this process. So, those that know and trust you, trust your judgment, and know that you're going to do the right thing as you get through this. Those that have a differing opinion will use every excuse to be able to take you down. And that's just a reality. And you have to be strong enough in your own convictions and belief to know that ultimately you're trying to do the right thing for the community, not for yourself. I mean, if you put yourself before the community, you'll always get yourself into trouble. But as long as you put community first, I think your motivations become much clearer and hopefully much more trusted. So the current situation we're in, we will eventually get out of this. I hope that at some point the courts will allow us to share with the community all of the facts that relate to decisions recently made. Until that happens, we have to work in trust. So.
Good. Thank you. I appreciate it.
I'll just echo a couple things that Commissioner French and Commissioner Kern said. I'll be probably a little more pragmatic. What I would say is that basically, I think Commissioner French kind of hit it on the head that when you take these types of roles on, be it elected or non-elected, you represent the community, as you have often said. You don't necessarily represent individuals in that community. You have to do what's best for the community. And we are a plurality. We're a nation of individuals and with vastly different opinions, everything like that. And I would say that one of the things I've learned in my 16 years of being an elected representative, although on a very small scale, is that for every person who does not like something you've done, there is a person who is very pleased with whatever you've done. So, but typically, as we are all human, the only time we ever squawk is when we don't like something. So when you do something and somebody doesn't like it, you're going to hear the negatives, and those are the voices that you hear the most. So you just have to remember that out there, there are people who will support what you've done. But as Commissioner French said, if you make decisions for the community, and understand that individuals within that community will sometimes take issue with what you've done, you are fulfilling the duty of this position, of your office, whatever, by looking out for that community.
Roger. Thank you, sir.
Thank you.
Well, thank you, Mr. Dranona.
Good job, Commissioner.
Thank you. We appreciate your time. I'm going to just say I echo what my fellow commissioners and board members said here, all three of them. And so, but we have hit the time where we need to get on to our next candidate. So I just want to say thank you so much for taking the time to interview, and we appreciate it. So have a great day,
guys. Thank you. Be safe.
Thank you. Okay, again, we are still, this is going to be for the community stakeholder interviews again. And Kevin Glover is our next interviewee. There we go. Hi, Mr. Glover.
Hi, nice to meet you all.
Nice to meet you too. Thank you very much for taking the time to put your name in and fill out the application and interviewing with us. We truly appreciate it.
Yeah, thank you. I'm excited to talk to you all.
Yeah. So just so you know, we do have 10 questions that we're asking everybody. They're the same questions from yesterday, today. I will be asking all the questions just to kind of go for, ease of trying to get us through them. You do have 25 minutes. And so I'll kind of let you know how we're doing on time and all of that as we go. But I am just going to get started just to give you the maximum amount of time. So question number 1 is, what is the role of the Spokane Regional Health District in our community, and what is your role as a board member, and why do you want to be a board member?
That's a good place to start. I see the Spokane Regional Health District as hopefully sort of a place of common ground where different interests within the community can come to gain better understanding about public health, have their voices heard about how public health policies impact them and their lives, and then also as a source of just quality information for the community. I think it should kind of be our focus of expertise in the community. So that's kind of how I imagine its role. In terms of why I want to be on it, I moved to Spokane about 10 years ago now for college. I went to Whitworth, and I love this community and want to start giving back. I was lucky. I'm in medical school right now, and I was lucky to be able to stay in town for that. We're pretty fortunate in that regard. So this seems to me like a pretty natural way for me to kind of start doing some more public service things, as I continue to live in Spokane and kind of continue my career here.
Okay, thank you. Question number 2, what expertise, diversity, and life experiences do you bring to the board that will be beneficial to representing our community?
Yeah, thanks. I obviously am not a medical professional. I am just a student. So I applied to the community representative position, and that really is what I'm interested in. So in the years after finishing at Whitworth, I was very involved with a number of different community serving organizations, especially around youth and youth interests. So I worked at a nonprofit called Peak 7 that sort of has a collaborative platform with other local youth serving nonprofits. So Peak 7 itself facilitates sort of youth leadership and adventure trips, and we work closely with other youth serving nonprofits to be able to basically meet the needs of those organizations with their goals. So that was one of the organizations, and then after that I was pretty involved with the school district. I taught for a year in the Meade School District at one of their cooperative programs for homeschooling students. Had a great experience there, and then also worked as a substitute in District 81 here in Spokane proper. So some really just kind of great community rooted things there. Really love our schools, and I think that Spokane has great schools. So I think in terms of what does that mean for me coming onto the Board of Health? I do want to continue to have sort of the interests and needs of youth and kids and young people in mind. That really is something that I want to bring, especially in terms of how public health policies impact, education, and how can we make things easier for educators right now and also for students. So those are some of my interests. And then the last thing I think I'd say is that since kind of being on the medical journey, I've been involved with CHAS, where I worked for a year and had a just really great experience of seeing what committed healthcare providers can do to really provide wraparound services for individuals who need them. So that's something I'm passionate about.
Thank you. So question number 3 is, what is your definition of public health, and why do you feel public health is important to our community?
Sure. I would define public health as being sort of sets of policies and shared knowledge that help people live the types of full, healthy lives that they want to on a community scale. I think I have a pretty expansive view of it. For example, let me think about an example here. Even something like, how do we expand access to green spaces in neighborhoods that don't have them right now, seems like an important way that public health can coordinate with, like, Spokane parks, for example. But obviously there are kind of much more classically defined things that make up public health, like, do we have safe drinking water? Are we able to dispose of our waste properly in a way that doesn't affect the health of people? And so all of those things are things that Srhd as an organization can manage well to improve the ability of people to live the types of lives that they want to live. That was the first part. Would you remind me what the second part of your question was?
So is your definition of public health, and why do you feel public health is important to the community?
Sure, thank you. Well, and I think in terms of why it's important, it's coming from the same place as my definition. It helps people live the types of lives that they want to live. It can be kind of empowering to individuals to be able to kind of be self-determined and to have the resources that they need to live a healthy life that isn't holding them back from pursuing their dreams because of things like preventable illnesses or unsafe drinking water.
Thank you. So question number 4 is, other than the COVID-19 pandemic, identify with I'm not going to be able to say it, specificity, 3 significant current public health issues and 3 future public health issues facing Spokane County.
That's a great question. Are you saying there's more than COVID-19 right now?
Exactly.
A couple things come to mind. The city's been engaged with the idea of fluoridating the water for several years now, and it seems to me that there's still a really substantive conversation going on about whether or not that's a good fit for the community. And so I think that a present issue facing Srhd is how can we help sort of bridge between scientific knowledge, community leaders, and community members to help everyone make a decision that is well informed and where people feel that their voices can be heard. So that's a present issue. Another issue that's on my mind, just because this is something I work on in school, is the city's, in some ways, the growing diversity of the city. And what I'm thinking specifically of is the increasing number of refugees that are resettling in Spokane. My understanding is that World Relief has started resettling dozens of Afghan refugees, is my current understanding. And I've heard that I think it's called World Concern is considering establishing an office to be another refugee resettlement agency in the greater Spokane area. And Spokane has an interesting relationship where the Board of Health has basically authorized unified clinics to do much of the screening and kind of incoming assessment for refugees who are being resettled. needless to say, though, that's still, an important population for Spokane. So I would say as our refugee community continues to grow, figuring out how to integrate them well into the sort of health ecosystem that we have there is one. And then another present issue, we're lucky we have great water for the most part, something that we don't have to worry about as much as other districts. I would say for another issue, and this goes back to my interest in young people, but we have such a mental health crisis in Spokane, and it is hard to see a behavioral health professional right now. I'm thinking especially of young people, and not that I've seen data from Spokane specifically, but if we match the trend nationally, then we know that our young people are really struggling right now with the isolation of the COVID pandemic, compounded with kind of rising rates of mental health issues. So, man, what can we do to expand accesses to mental health services and to partner with, the great organizations that we already have, like Frontier, with the new behavioral health hospital that opened up just right north of Sacred Heart that I'm forgetting. So those are three kind of present issues. And then I'll try to go through three future issues quickly. Wildfire smoke, I think, will unfortunately continue to be worse and worse until it gets better. So I think even how can we partner effectively with Washington's Department of Public Lands to, reduce fuel loads around Spokane? In some of our forested land around here. In terms of, we can't do much if smoke is coming from Canada or California in terms of preventing it, but what can we do to help residents understand how to keep them safe? And I think the Board of Health has already done a good job with that, in terms of even things like improvised filters, closing your windows and things like that. So anyway, wildfire smoke is one. It's tough to separate future and present issues to some extent. Another future issue that I expect is, currently here, and I think will keep getting worse, is just teen substance use, especially with vaping. That's already a problem. I think it'll continue to get worse and worse. But I'd be interested in thinking about how how SRHD can partner with local school districts to implement more effective strategies to help young people not use vapes and to not get addicted to nicotine early in their life. So I think that'll be a concern going forward. One last future issue. Let me think about that. Something that's on my mind, Spokane is a growing community, and the entire inland Northwest is really experiencing a lot of growth right now. And we were fortunate to have sort of forefathers in Spokane with a lot of insight in terms of planning a city around green spaces and open spaces. It would be great if SRHD could continue to be involved in making sure that as Spokane expands, we recognize the importance of access to, clean green spaces for growing families.
Very good. Thank you.
You bet.
So question number 5, and we've got, we go to 10:15.
Great.
Okay,
I'll try to hurry up.
We're good. No, I think we're good. I just want to keep us on track. Describe your experience and philosophy as it relates to the board's responsibility for governance of the health district, including interactions with the SRHD administrative officer, financial oversight, and decision makings when faced with differing viewpoints from fellow board members, staff, health professionals, and the public.
You bet. And I don't know if I'm frozen on your screens, but I can't see your videos right now, which is not a huge problem. I'll keep talking, but I can hear just fine.
Okay, and we can hear you, so.
Great. Okay, great. That's all we need. I think a value that is still alive in our society and maybe can come back is to assume good intentions about other people who are engaged in public service. In terms of the board interfacing with our SRHD, I think freely admit that I stand to learn more about the formal ways that relationship is structured. But in terms of working across differences within the Board of Health and then with SRHD when those differences arise. Being able to maintain an atmosphere of cordiality and a sense of mutual respect for other people who are engaged in public service. We do live in an increasingly polarized time, and I think on the local level, we still have a lot of potential to, reclaim a sense of being colleagues and working towards a shared goal of making the health of the region better. So that is sort of the team-based mindset that I'd want to bring.
Thank you. Question number 6 is, how will you respond should your personal beliefs conflict with directives from the federal, state, or local government?
Sure. I think fortunately that's something that medical school prepares us well for. One of the sort of tenets of how I'm being trained is to put the needs of the person in front of you above your own. And to the extent that, I do have certain moral principles that are important to me and that I wouldn't want to sort of falter against. I think recognizing that other people have points of views that are different than my own and are just as valid as my own are very important in sort of my professional growing identity and are just as important as being part of the Board of Health, recognizing that other people's values are valid.
Thank you. Question number 7. Do you have any political conflicts or any political potential? Sorry. Like today, I'm like not reading my questions well.
That's okay.
Like my contacts are not not as good today. There we go. Question number 7. Do you have any potential conflicts of interest, such as contracts with the health district, close relationships with an employee of the health district, or a financial interest in the rendering of health services in Spokane County?
You've been doing this for a long time, and I think you're doing a great job with questions. Fortunately, as 28-year-old, I don't really have any financial liabilities right now. So I think I can say no, I don't have any conflicts of interest at this time.
Okay, thank you. Question number 8 is the Board of Health meets monthly for 2 hours, and there's also committee work that can take 2 to 4 hours per month. Do you have the time and flexibility to take on this responsibility in a consistent and prepared manner?
Yes, I definitely can accommodate that. We have quite a bit of flexibility in our academic calendar. And, one question I have for you all, if this is a good time, I'm curious if the functions of the Board of Health will continue to be virtual for, another 6 months or 12 months, or if you forecasted that out at all.
So I will say we have not forecasted that out.
Sure.
It is just, as you know, everything changes almost daily, it seems like, as to what we can and can't do. So we don't know. We hope to be back. We've been virtual for almost 2 years. But I'll let you ask more questions in a minute. I've got one more question, and then we'll go there. Please give us your opinion as it relates to naturopath or alternative approaches to community health.
Sure. That's an interesting question. I will say that I've not thought a great deal about how naturopathic training applies to public health. I think that I may be... It's interesting, being in medical school because there are a range of opinions about, sort of naturopathic practices. And I think I err a little bit more on kind of being open-minded towards the ways that that training pathway can complement the focus of my education, which often can be somewhat narrow. So in terms of, I think I come to it with an open-minded perspective. I think certainly I would have a higher degree of personal regard for individuals who have undertaken that training and are interested in giving back to public health from that point of view. I was unaware about whether or not public health is a part of that training pathway, which could just be my own ignorance. And I think I'd be interested in learning what. Basically, what a naturopathic practitioner could bring to public health, because that isn't something that I've thought of a great deal.
Okay. So the last question is question number 10. Do you have any questions for the panel that you would like to ask? Or we also have a few more minutes. I think we've got like 6 or 7 minutes that if you would like to expand on any of the questions that you felt like we didn't expand on, you're welcome to do that.
Yeah, sure. Thank you. I do have a few questions, and you've helped me with the the forecast, such as it is, about whether or not these will continue to be virtual. I was curious, and forgive me if I've missed this somewhere in the application materials, but are these, if I have an appointment to the Board of Health, is it for a set amount of time, like 1 year or 2 years, or?
Well, I can say I'm not sure that we have actually identified what those times are. I can ask, check with my other commissioners, but I think I don't know that we've set what that rotation is.
Sure.
So
that's okay.
But it is something we need to be doing as we move forward and fill the board positions.
You bet. Sure. And I think to be transparent with kind of my availability, I will be in Spokane for at least 2 more years, and would love to serve for whatever duration there is there. And I am hoping to do a family medicine residency here in Spokane at the Providence residency, but there's not a guarantee that I'll get a spot there. So that's kind of my next 2-year forecast and my availability. One thing I've also wondered about, I say this kind of tongue in cheek because I'm at the UW School of Medicine. We're lucky to have Wazoo in the eastern half of the state, and their medical school is 5 years old. It's doing well. Has there been much bridging between Wazoo as sort of its own generator of science and scientific knowledge between them and SRHD or the Board of Health, as you guys have seen it?
I don't know if any of my fellow panelists. I do know that there's definitely coordination and discussions that are going on between our health officer and the school. So I do know that is going on. I believe with the administrator as well, but I know for sure with the health officer that he's in contact with WSU Medical School and been talking about what the opportunities are that they can reach back and forth. And I know different committees that they're on, that there's people from WSU School of Medicine as well as from the Regional Health District on those committees. So
that's great.
I do know there's outreach that's going on back and forth.
Okay, great. Another question I have, you bring up committee work. Could you tell me a little bit about what some of the committee opportunities are like within the Board of Health?
Yeah, Commissioner Kearns, would you like to talk about the policy committee?
Yeah, so there's a couple of different standing committees. The one that I have served on for the past couple of years has been the policy committee, and then it merged with the education committee. I want to say a little over a year ago. And so essentially the focus of those two committees jointly together were to focus on if there are any specific issues we want as a board to receive presentations on, if we wanted the board to kind of take a deep dive in, sort of trying to do that forward look in the next 12 months. What are emerging issues that maybe we as a board don't have a deep knowledge on that we'd like to bring in an expert on that issue to present? From the policy side, we're also the committee that develops the legislative agenda. I want to say that's usually, correct me if I'm wrong, I looked at my fellow board members, usually October, November. We adopt that so we can then submit that to our legislators before they head over in January for the legislative session to start, so they kind of know as Spokane Regional Health District, these are the things we would like them to focus on while the legislative session is meeting over in Olympia. So those are the primary functions of that committee. There are other committees but those are the ones that I serve on. So I don't know if Kevin or Mary, the ones that you serve on with the exec committee, and I think there's one more I'm forgetting.
The finance committee. We'll let
committee. Yes.
Mayor Freeman speak to the finance committee.
Okay.
That's right.
So the budget and finance committee is pretty much what the name sounds like. That is, on a monthly basis, reviewing the vouchers and claims that are processed by Spokane Regional Health District, looking through those, providing any input or any questions that the board might have, and vetting those expenses, claims, et cetera, before they go to the full board for their consideration and approval. So we try to do most of the legwork, identify anything that may need further explanation to the board or may raise not necessarily a red flag, but something that we as board members try to think about. If another board member might have a question on this, we ask SRHD personnel, finance, administrative officer to be prepared for that prior to the regular board meeting. And then that committee also works with the administrative officer to vet, understand, prepare, and generate an annual budget for the Spokane Regional Health District. And then we work on that budget for the intent of two things. One is to present it to the board for their approval for the budget for the agency, but also prepare the funding request for our local health funds that is made to the Board of County Commissioners. So it is a two-part exercise in basically going through the finances of the board, setting the budget for the next year, preparing that budget for submission to the Board of Health, which is the Board of Directors, and then also preparing the actual financial request that goes to the Spokane County Board of County Commissioners for their funding, as is required by state of Washington. Local jurisdictions have to fund the local health district,
Sure.
in some respects. So that's what we do in budget and finance.
Okay. Thank you.
So Kevin, or I should say Mr. Glover, I apologize. We are at the end of our 25 minutes. And so I just want to be, consistent with everyone. I just want to say thank you very much again for applying, for taking the time to interview with us today. And we hope you have a great day.
Yeah. Thank you all for your time. And I hope you guys have a good day with the rest of your interviews.
Thank you.
Take care. Bye-bye.
Okay. Before we break, we do have a break of 10 minutes set in here. I do want to just say that the interviews that we just had were for the community stakeholder group, of which that was Mr. Charlie Nona, Mr. Kevin Glover, and then we have Dr. Denise Smart and Dr. Daniel Repsold. Those are the four that are for the community stakeholder group. So I just want to make that. And then after our short 10-minute break, we'll come back and we've got two more interviews for Consumer of Public Health that we have. And again, just a reminder that Mr. Chris Patterson that we interviewed at 9 o'clock is also part of that group. So just making sure we keep them all straight since we're kind of mixed them up. So thank you. We will take a 10-minute break and be back at 10:20, just like a minute before 10:20. Will be 10:24, so that way we're ready for Ms. Michelle Anderson. Thank you. Okay, it is 10:24, so I'm going to see if I can get everybody back so we can be ready for our next interview. Please note that the next interviews again are for the Consumer of Public Health, which we have 2 candidates that will go back to back. And we have Mr. Chris Patterson that we interviewed at 9 o'clock. So it'll be those 3 candidates that we have for the Consumer of Public Health. And so, and seeing it's 10:25, if Ms. Michelle Anderson is available, we can bring her on. Yeah. Hi, Michelle Anderson, correct?
Yes.
Hi, how are you doing today?
I'm good.
Good. Well, thank you very much for taking the time to fill out the application and coming for the interviews today. We really appreciate it. We'll be interviewing you as one of our Consumer of Public Health candidates. And what we do have, just so you know, is we have 10 questions that we asked everyone that we've interviewed so far, the same 10 questions, yesterday and today. I'm the chair, Commissioner Mary Cuney, and I'll be asking those 10 questions. And then we have about 25 minutes, so I'll kind of, if I need to let you know we're running out of time or not, I'll try to do that. But I will just ask all the questions just for ease of trying to work our way through in the 25 minutes. So thank you again. And then I will start with question number 1. What is the role of Spokane Regional Health District in our community, and what is your role as a board member, and why do you want to be a member of the board?
Well, we set precedent and policy, the Board of Health, for things like communicable diseases, reportable diseases. That's kind of where I got involved with this, is doing public comment on some of the new laws that are being passed for what is a reportable disease and how much time they have to report it to the state, that kind of stuff.
And the second part of that is, why do you want to be a member of the board?
Because I like being able to put a little common sense into keeping, we kind of get a little crazy when it comes to all the different rules and laws, and to just be able to keep some common sense and that you're governing people, you got to have some common sense with the people.
Thank you. So question number 2 is, what expertise, diversity, and life experiences do you bring to the board that will be beneficial to representing our community?
So I have used the services that are available through our Board of Health. When my children were little, I had a public health nurse. And so even my daughter had a public health nurse with her children. And it's a wonderful, wonderful program. It's a great community resource. And I would definitely like to see that continue. For a young single mother who doesn't know what she's doing, to have someone that you can call and say, my child's sick, what do I do now? It's an invaluable source.
Thank you. Question number 3 is, what is your definition of public health, and why do you feel public health is important to our community?
Well, public health is the public's health, to encompass the majority of the people, I guess, because you can't always get everybody. So you have to do the best you can for the majority of the people. And I'm sorry, what was the second part of that question? What's my role?
And how do you feel public health is important to our community?
It's important to keep people as healthy as possible so our community continues to grow and thrives.
Thank you. So question number 4 is, other than the COVID-19 pandemic, identify with specificity 3 significant current public health issues and 3 future public health issues facing Spokane County.
I would say a big one is the fluoridation of our water, which a lot of people are opposed to. The cleanliness of our Spokane River. There's been a lot of water quality issues between Idaho and Washington state line. They're like, oh, well, we're just going to not count it polluted anymore at the state line and we'll start over, which is not really how that works. And I guess the last one I would think would be maybe air quality. How do we address that? I'm not exactly sure, but it has to be a component of the public health.
Good. Question number 5 is describe your experience and philosophy as it relates to the board's responsibility for governance of the health district, including interactions with the Srhd administrative officer, financial oversight, and decision-making when faced with differing viewpoints from fellow board members, staff, health professionals, and the public. I know that's a big, long question, so I had others where I've repeated, so don't worry if you'd like me to repeat some of that or all of it.
Yes, I would. I'm sorry. Yes, would you repeat the whole question and give me just a second to write down some notes in between?
No worries. So describe your experience and philosophy as it relates to the board's responsibility for governance of the health district. It's kind of the first piece of that.
Responsibility. Okay.
And then including interactions with the administrative officer, financial oversight, and decision-making when faced with differing viewpoints. And that those differing viewpoints can come from fellow board members, staff, health professionals, or the public.
Okay. I don't have any specific experience as a board member for any boards. So what do I think the whole board's responsibility is to do the best we can to keep the majority of the people in Spokane County healthy and happy. You can only do as much as you can do, and nobody's perfect. So you just have to work within whatever the guidelines that are already set. I would hope that I would have a priority list for decision making based on what what's the highest priority versus what's the lowest priority. And financial will always be a concern because somebody has to pay for it. Every decision you make, somebody has to pay for it. And I would think that you could have civil interactions with every single person, whether you disagree with them or at least be able to listen to a differing point of view and try to understand it, even if you don't agree with it.
Very good.
Okay, I think that's all.
I just want to make sure, is that all? Or
I think so, yeah.
Okay, thank you. Great job. Question number 6. How will you respond should your personal beliefs conflict with directives from the federal, state, or local government?
Well, is it a directive? Is it a law? Is it so if it's a law, it's a law. You have to follow the law. I don't know. I won't know until I'm faced with that decision. I would hope that I would put the interests of the community above my own interests.
Thank you. Question number 7 is how do you have any potential conflicts of interest, such as contracts with the health district, close relationships with an employee of the health district, or a financial interest in the rendering of health services in Spokane County?
I do not, to my knowledge. I do have a friend at the health district who is my public health nurse who still works there. And you guys, if you've been there for any time, you probably know who Mickey Hill is. I consider her a friend all these years later.
That's awesome.
But other than that, I don't see any other conflict. I just went back to college, so I'm kind of doing all that right now, just trying to finish my 11 credits for my AA. So,
wow, I'm excited for you. That's great.
Yeah.
And so no,
this
I don't.
whole online learning thing is so brand new.
Okay, so then the next question number 8, is the Board of Health meets monthly for 2 hours, and there is also committee work that can take 2 to 4 hours per month. Do you have the time and flexibility to take on this responsibility in a consistent and prepared manner?
Yes. Especially if I know ahead of time. So you said 2 hours monthly plus
2 to 4 hours for committee work. So our meetings are scheduled, our set board meetings are the fourth Thursday, 12:30 to 2:30 every month.
Okay.
So that's set. And then the committee work usually is a little more flexible based on timing.
Okay. And Thursday's my scope day, so usually noon to 4. We do radar.
Okay. And we do meet then the fourth Thursday from 12:30 to 2:30.
Okay.
That's our regular board meeting. So, okay. Question number 9 is, please give us your opinion as it relates to a naturopath or alternative approaches to community health.
I'm sorry, I'm still writing that down.
That's okay.
Alternative?
Question number 9 is, please give us your opinion as it relates to naturopath or alternatives approaches to community health.
I think there are tons of alternative approaches to community health. We're learning new stuff every single day, so there's always something new that we didn't know yesterday. I think we have a pretty decent framework to start with, and I feel like there's always room to expand and grow.
Great. So I'm just looking at our time. So we have like 13 minutes. This is the last question I have, and so you can go back and if you want to answer any other questions more thoroughly, you can do that. Or do you have any questions for the panel that you would like us to answer for you?
I do have a couple of questions.
And we're happy to take those.
Okay, you said you had one more question.
That's the last question.
Oh, okay. Okay.
That's question number 10.
Okay. So, you had some questions about financial, and my question was, is there somebody that specifically does grant writing for the Department of Health for like to get federal funding and that kind of thing? Do we have a specific person that does that, or is it kind of a community or group effort?
I see Mr. Freeman shaking his head, so I will let Mr. Freeman answer.
So we do have individual departments within the health district. We have environmental health, epidemiology. Those folks that are those management and leads each have individuals there that work on their set of both federal and state grants. We do also have individuals within the SRHD that assist with grant writing, grant monitoring, project management, things like that. The SRHD does receive a significant amount of federal and state grant funding that makes up a large portion of their budget. But mostly those department directors are responsible for working with their specified staff to write those grants.
Okay.
Thank you.
does Department of Health do any, sorry, I don't know what word I want to use. Do they do like education stuff for like ECAP, for like the Head Start programs? So back when Mickey was my health nurse, Department of Health put out like a resource book that was invaluable. And so I'm wondering do we share that resource with like the ECAP programs, where to disseminate information, get more information out there to the people that need it.
So I am not sure on specifically for that program. I mean, since we have several programs, but I do know, I mean, that is one of the basic things we do is trying to educate. And so I know that we work very diligently as getting information out to keep our community safe and healthy. And so if that's coming from the nurse family partnership, I would assume that it's still there and still being used, has been updated. I don't know if that comes from sometimes those will come from the State Department of Health down to us, and then we disseminate that information, or if that's coming directly from us. But I do know that's one of our, roles is educating and providing information to keep everyone safe and healthy. So I'm glad to hear that you found that helpful and useful for you.
Yes, wonderful. And to actually share that same information with friends and family, as those things came up.
Yeah, no, I think that's great.
I think that's all the questions I have.
Okay. Well, I want to thank you very much for participating. And like I said, for filling out the application and being here for the interview today. We've got another interview coming up. And so we thank you very much and hope you have a great day.
All right. Thank you. Have an amazing day. It was wonderful to meet you.
Nice to meet you too.
Okay. Bye-bye.
Bye. So we have 8 minutes until our next candidate, which is Mr. Jeff Allen Fortin at 10:50. So we will do what we've done so far. We'll take a little break until about a minute before, till about 10:49. And then I'll come back on. So we're on time for Mr. Jeff Allen Fortin. Thank you. 8:49. So I'd like us to all come back because at 10:50 we have Mr. Jeff Allen Fortin coming on. Okay, and I guess we'll just let us know and go ahead and feel free to bring on Mr. Jeff Allen Fortin. Hello, Mr. Fortin. Hi, I'm Commissioner Mary Cuny. Can you hear us okay?
Yes, I can. Can you hear me?
Yes.
Good morning.
Good morning. So I want to thank you for applying and filling out the application and coming in for the interviews. We really appreciate this. Just a little bit about how it's going to go. We have 25 minutes. We've had that same time period for every one of the candidates that we've interviewed yesterday and today. We have 10 questions that are the same questions that we're asking everybody. So that way, just keeping an even playing field. And so I'm going to just, for time purposes, we have your application or your resume and your application, so we know that information. So I'm going to get started with the 10 questions, and I'll be the one asking those, and I will just go through them. And then at the end, if you've got questions for us, we can answer those for you. So
thank you.
Thank you, and thank you for joining us today. So question number 1 is, what is the role of Spokane Regional Health District in our community, and what is your role as a board member? Second part of that is, why do you want to be a member of the board?
Public health within a jurisdiction, the biggest issue facing any agency is building trust in the community. Taking the elements of public health, the accessibility of those services to the underserved, to the non-persons that are homeless, as well as citizens that are having struggles throughout their life. I see a role of a commissioner on building that bridge of trust, taking the information, for example, the last 2 years with the pandemic. We've politicized that situation and have totally confused the public. Our job as board members are to build that trust, build bridges to the different groups and people, and showing them the access to achieve the end of good health, access to health care, social service programs, justice service programs, and the ability to move on with their life, even when they need to have assistance from a public agency.
Question number 2, what expertise, diversity, and life experiences do you bring to the board that will be beneficial to representing our community?
Over the past 50 years, I have been self-employed and have worked for various employers. With my business background, I became disabled in 2015 due to military conditions, and I have not worked, so I basically retired in 2015. What I bring to the board is we grew up poor, and as a child, I've spent 12 to 14 years on welfare, school lunch programs, milk lunch programs, Medi-Cal, Medicaid. As an adult, I've had a few years of needing to be on SNAP and Medi-Cal when I was a student in my younger days. And as an adult, I have served various state organizations, numerous county organizations, and city organizations as commissioners and board members in social services, justice services, law enforcement. I helped move the Private Industry Council to the Workforce Investment Board when they did the changeover in California. I have spent 40 years volunteering my services with government agencies. I was the youngest police commissioner ever appointed in the city of San Bernardino when I was 23 years old. I've held 25 political appointments. I have chaired 7 of those commissions, and I was recognized by the State Assembly and the State Senate in the state of California, as well as the Board of Supervisors in San Bernardino County, Santa Clara County, for my services to the public as a volunteer. I bring you those 40 years of experience. I bring you 50 years of business experience, and I, as a senior citizen, completed my bachelor's and master's degree in organizational leadership, finance, and general management. So I bring to you a candidate with the experience of using services when they were needed, giving back to the community without seeking recompense, and being able to serve the community as a business leader, as well as aiding in the advancement of government services to the public. As well as spending 18 years in the military. I spent 9 years.
So we just lost your audio.
Am I back? Am I back? I didn't do anything to the audio.
Oh, yep, now you're back.
And I spent 9 years in the Army as a commissioned officer.
Okay. Thank you for all of that service. We appreciate that. So question number 3 is, what is your definition of public health, and why do you feel public health is important to our community?
Public health is an umbrella for a variety of services. 15 years of my life, I was a registered environmental assessor, and I took fuel tanks out of the ground. I remediated oil and gas spills. I ensured businesses were in compliance with health regulations, water regulations, pollution regulations. All these issues, from business, public needs for public assistance, all work hand in hand with moving society forward. It comes down to the haves and the have-nots. And unfortunately, the need is greater than the ability to deliver those needs. And we need to take slim resources and allocate those resources in a manner that best serves the maximum of the needed public. But public health is important because in the last 2 years, America's lost 1 million people from this virus. We fought over vaccinations. We fought over masks. But the bottom line is people are dying. Healthcare is overworked. People are overstressed. The public is confused. Trust is at a low-time low. And there is not an adequate leader that people can look at and say, I feel safe and I feel secure. Our job from a local standpoint is to bridge that information, have cohesive leadership, and deliver those public services in the best manner possible so the public can be safe as much as we can provide safety, as well as assistance when it's available.
Thank you. Question number 4 is, other than the COVID-19 pandemic, identify with specificity 3 significant current public health issues and 3 future public health issues facing Spokane County.
Without COVID, the biggest effect is homelessness. Second, the drug epidemic, the opioid epidemic. And third, access to medical care. The public, looking forward, resources and funding will become an issue. Different groups competing for the same dollars. Healthcare organizations being able to serve diverse groups of individuals. identifying the non-person, which I consider the people that are homeless, that have no addresses, that have no workplaces, that subside on a few dollars a month and the handouts from strangers. Environmental concerns, business needing regulations, keeping clean water, clean air is important. And all the events that we have currently facing Spokane County and the issues in the future are not unique. They've been here before. Different circumstances, different time, different people. Doesn't change. Humanity doesn't change. Problems don't change. They just get larger, more costly.
Okay, question number 5 is describe your experience and philosophy as it relates to the board's responsibility for governance of the health district, including interactions with the administrative officer, financial oversight, and decision-making when faced with differing viewpoints from fellow board members, staff, health professionals, and the public. I'm happy to repeat some or all of that again.
What was the question? I missed the question. I got the gist of it, but I missed the question.
Yeah, no, that's just fine. So I'll repeat it. Describe your experience and philosophy as it relates to the board's responsibility for governance of the health district, including interactions with the SRHD administrative officer, financial oversight, and decision-making when faced with differing viewpoints from fellow board members, staff, health professionals, and the public.
Thank you. The biggest success a board has is cohesive leadership. Communication between the board members of what the issues are, who the impacted groups are, what are the for, against, pro, con, support, not support. There have been many times in the past when decisions are made that are contrary to the opinions being stated by the public. Government sometimes makes decisions in the best interests of the collective good. But you need transparency in a board. You need openness. You need honesty. You need to share information as information is available and available for distribution. You need to ask questions of groups and participants on why they take the positions in which they do, and try to filter out the politics, try to filter out the political party, try to filter out the stress and financial worries that these groups may or may not have, and depending who's supporting them, not supporting them. But bottom line, the board's responsibility of governance is to interpret the regulations and laws and implement policy and procedure both to the public and to the district personnel that allows for the delivery of services in the best method possible, maximizing dollars for the end result, being open with the public, being honest with the public, being transparent, and staying within the budgetary constraints set by the board, set by the state, or set by the federal government.
Thank you. Question number 6 is how will you respond should your personal beliefs conflict with directives from the federal, state, or local governments?
We live in a society governed by rules and regulations. They say the most important document is the Constitution of the United States, followed by the state constitution, followed by state law, local law, regulations, ordinances, and resolutions. Most Americans are law-abiding citizens. They don't need to be reminded the right and wrong, what to follow on a day-to-day basis. The board has an obligation to set policy that the public can understand. They need to interpret federal regulations that evolve, that change, administration to administration. They need to face the fact that Washington state is different than Massachusetts. So state policy, state regulations, state priorities need to be factored into those decisions. And even though we have federal laws, state laws, it just comes down to what is right. How can we work together as a team, articulate changes and requirements to the public, make policy that makes their lives better. If it doesn't, find ways to educate them so it does. And understand that we all have our own moral compass. We all have our own experiences. We have our own understandings. But I do believe that when you come together as a group and you communicate, you listen. You may not agree, but you listen. You articulate your positions. You vote on matters. And majority ends up having a policy presented to the public, whether it is a state, federal, regional regulation interpreted for the delivery of Spokane County.
Thank you. So question number 7 is, do you have any potential conflicts of interest, such as contracts with the health district, close relationships with an employee of the health district, or a financial interest in the rendering of health services in Spokane County?
I do not.
Okay. Question number 8 is, the Board of Health meets monthly for 2 hours, and there is also committee work that can take 2 to 4 hours per month. Do you have the time and flexibility to take on this responsibility in a consistent and prepared manner?
Yes, I do. At 65 years old, not working, I find I have a lot of time on my hand, and staying relevant and staying needed, you have to reach out and find things to do. But I am willing to serve. I have the time to serve. I have no external things driving my time. I have no family, so I'm here to help the health board reach their goals.
Thank you. Question number 9. Please give us your opinion as it relates to naturopath or alternative approaches to community health.
Can you repeat that question, please?
Yes. Please give us your opinion as it relates to naturopath or alternative approaches to community health.
There's a lot of alternative methods to public health. When you look at the medical side of health, there's alternative medicine, there's acupuncture, there's chiropractic. There's ways of educating people and the public as a whole to take actions to improve their life that doesn't cost financial dollars. When an organization sets a policy or sends out a newsletter and shows ways of doing things to improve one's life, to improve access to services, to prove accessibility to health care, to reach the undercounted, unrepresented, and non-people so they feel part of the solution, and you seek input from a variety of stakeholders, you can develop a lot of organizational programs, instructional awareness, or just plain bulletins to make your life easier that's not costing a lot of social and justice dollars to the citizens. What those alternative programs are, they're unique to each individual need and circumstance. And if healthcare is an issue, the alternative is to find ways of getting access available to individuals. Then you understand there's a resource requirement after you've identified them. But there's a lot of ways you can reach people.
So we just lost your audio again.
I'm back.
There, you're back.
Okay, I've concluded on that aspect.
Okay. So the last question is question number 10, which is, do you have any questions for the panel or we still have 6 minutes. So if you would like to go back and answer any, further answer any other questions, you can do that as well.
Thank you. Well, my access to services as an adult was roughly 5 years as I was a student and as I transitioned from the Great Recession and my move to the Pacific Northwest. Most of it was when I was a child. And having the services available was very important. I was a 6-month baby, so in Massachusetts, when you were born at 3 pounds or under, they took control of you, and I spent 90 days in an incubator under the state program, so the state paid for that. Having a single mother, raising 3 children, it was rough, and going to school hungry was rough. Having to retire at 58 because you can't work because of service-connected disabilities, and a 7-year fight to get 100% disability with the service, I have a lot to offer the board. And I feel that my professional background, as well as my personal background, fits within the spectrum of being an effective board member for the citizens of Spokane County. We have 500,000 citizens here. I represented 450,000 representatives in Monterey County, and I represented 1.5 million citizens in Santa Clara County. So I feel I have the expertise to drive and the knowledge and the time to be an asset to your board today, tomorrow, for all the issues coming and facing this county at this time with our problems. And I just want to thank you for inviting me to talk to you.
No, thank you. We appreciate, again, all the service that you've given over the years. And I guess I just want to check and see if you have any other questions for us before we let you go.
No, I do not. I am familiar with those who are serving on the board. I look forward to meeting you in person. And I just want to let you know that public service has been a paramount important to me. And even though I've been blessed with a professional career, unfortunately, the technology boom bust and the Great Recession hit me harder than my volunteer service, which I hang higher on my to-do list than my professional career. But I want to thank you all.
Well, thank you. Again, we appreciate you and everything you've done. And thank you again for applying and interviewing with us today. We truly appreciate that. And I think if you don't have anything else, then we'll let you go. And we are going to be making some decisions.
Thank you so much. God bless. Have a good week.
Thank you. You too.
Bye-bye.
Okay, so that concludes our interviews. That was our last interview. Again, Michelle Anderson and Jeff Allen Fortin and Chris Patterson, just to make it clear, are part of the Consumer of Public Health group. So those will be the 3 that will be evaluating for the Consumer of Public Health. Which we just finished the last interview for that group. So I know yesterday we took about a 5-minute recess for us to have time to think about it. I see Mayor Freeman shaking his head. At this point, I would say let's come back we'll just take 5 minutes. We'll come back at 11:20 to give ourselves a chance to think through the 3 groups, because we've got the group from yesterday. We've got the Consumer Public Health interviews, the Consumer Community Stakeholder interviews, and yesterday was the Public Health. section. So, so we'll take 5 minutes, kind of think through those, and come back at 11:20. Hello, welcome back. Waiting for Commissioner Kearns and Commissioner French. There's Commissioner Kearns. And Commissioner French. Okay, thank you all for coming back. I just want to thank the public again for everybody who chose to apply and put their names in through this process, for taking the time. Thank you to all the people that interviewed and helping us make it happen in these 2 days. We truly appreciate that. I know it was, effort on everyone's part to try to find everyone's schedules and time. So thank you to everyone for making this happen. We all feel that it's very important, so appreciate that. So I think since we've left off yesterday and had a motion to continue our deliberation on the public healthcare representative, I think we will take that up first. Unless, Michelle, if you see a reason for us not to? Okay. I wasn't sure whether you were turning away if I needed to do something, or so just checking.
I just had to grab my paper from yesterday.
Okay. Mayor Freeman.
So yesterday, prior to at the beginning of the deliberations, I tendered up 2 candidates, and the commissioners, Ms. CUNY, Mr. French, Mr. Kearns, tendered up 3 to 4 candidates. So I would say, based on the limited support that I was seeing through the process for the candidates I tendered, I reviewed the remaining pool of applicants, and based on their interviews, I would add Miss Alicia Policani to my list.
Okay. Thank you. That is noted. Commissioner French.
Yeah, so Madam Chair, with that consideration, and I appreciate the deliberation that Mayor Freeman went through on his own. That puts Policani on the list for all 4 of us. And so I guess I'd like to make a motion that we go ahead and appoint Policani to represent the healthcare providers.
I'm not sure appoint is the correct word, because we're just moving it forward to the Board of County Commissioners.
Nominate.
Thank you.
Mm-hmm.
Is there a second?
I'll second.
Okay. We have a motion and a second to nominate Dr. Alicia Policani to the Health Board, and that would move forward to the Board of County Commissioners. Any other discussion?
I just want to I'll speak to this. I think Ms. Policani presented very well yesterday. I think a lot of the things that she hit on, quite frankly, are very important to public health. I really liked how she touched on healthy living. I mean, she touched on, just the general overall health of individuals. I liked that she touched on other programs that are offered at the health district. I mean, right now, the only thing that you see associated with SRHD, if you turn on the news or you open up a newspaper, is COVID. There is a lot of things that are done at SRHD, and quite frankly, a lot of our interviewees touched on that. I mean, everything from from social services that are asked there, for for new mothers, for WIC. I mean, everything from on-site septic systems to food handlers permits to restaurant safety. I like that she touched on that. There were other candidates that touched on that as well for all three positions. But, I think I think she'll be a good board member, and I think she'll do a good job. I do want to also take the opportunity to thank Dr. Kinley and Ms. Frostad for their work on the health board. I think both of them have done a good job. I think both of them interviewed very well yesterday as well. I don't want their service to go unnoticed. They both were fantastic board members. And at the same time, unfortunately, he is no longer with us. I also want a big thank you to Chuck Hafner for the work that he had done for the health board under its former structure. This community is very lucky for the service that those three individuals have put forth, the effort and time, and quite frankly, I think the health district is better because of all three of their service.
Yeah, and I'll speak to this as well. Oh, Commissioner French, I see you've raised your hand.
I can yield to your comments, Chair.
Okay. Thank you, Josh, for, I think, stating that those three, citizen appointees to our health board really provided a lot of great input and service to our health district, and Chuck, for years, did that. So I would say thank you to all three of them, and with Jason, Dr. Kinley, and Ms. Frostad, they were really great board members here as well. So, decisions are hard. It's not easy, and it's as we spoke earlier, you're never going to make everybody happy. I do want to just say, as I said yesterday, my three were, and I'm going to go ahead and just rank them, because I think it's, I want to make sure that I have that. I think Dr. Monica Blakowski would have been my first choice. Dr. Policani is my second, and then Dr. Kinley my third. And seeing that, we have 4 people that are willing to put Dr. Policani forward, I will be able to then move forward with that. Commissioner French?
Yeah, thank you, Madam Chair. So as I look at this position and this opportunity with Dr. Velasquez and the staff that we have at the health district now, we have a wealth of knowledge in traditional medical approach, and so we're very lucky in that way that we've got such a great bench, if you will, of medical practitioners and stuff. So, in terms of Dr. Policani, the thing that I like about her, not only her medical background and the fact that she also is a naturopath, but the other thing that really struck me, and I think Josh started to talk a little bit about this, is the fact that she's not only a medical professional, but she's also a consumer of the services. She used WIC as a single mother. She knows those services firsthand. She provides services to members of the community that otherwise would not have access because of lack of insurance. She deals with, she is an immigrant, and she deals with the immigrant community. And so it was not just her medical experience, but the wealth of experience that she brings to the board that I found appealing and stuff. So, Andrea Frostad was my appointment to the health board, and she served the board really well. Kinsley, I think he did an outstanding interview yesterday, and has also served the board well. But I think the thing that tipped me over with Policani was the breadth of her experience with the health district already, and seeing it not only from a medical professional standpoint, but also as a consumer, gave me that additional opportunity to support her. So I thank you, my fellow committee members, for your consideration.
Any other discussion? Seeing none, we have a motion and a second to nominate Dr. Alika Policani to move forward to the Board of County Commissioners for appointment to the Health District Board. All those in favor, please signify by saying aye.
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 Aye. Motion passes unanimously. So the next one that we will look at is the community stakeholder. We have 4 candidates. We have we have from yesterday's interview, Dr. Denise Smart, Dr. Daniel Repsold, Charlie Duranona, and Kevin Glover. I don't know if we want to discuss or if you guys are ready just to make a motion.
I'll step forward. First, I want to say we had two great interviews yesterday, and we had 2 great interviews today. As far as I'm concerned, I really like what Charlie Duranona brought to the table. I like his work with veterans. I liked he seemed to have a pretty good knowledge on the services that SRHD offered based on his previously working in the building. Again, I got a really good feeling about him that he's going to be a great board member. I quite frankly, the issues that he brought up, and it was brought up by multiple candidates through a lot. I mean, mental health, suicide prevention, opioids, homelessness and poverty, those are major issues that we're going to be dealing with. And I'd like to put forth Charlie. I'm willing to make a motion unless someone else wants to speak before I make a motion. Okay, well then I will make a motion that we nominate Charlie Duranona to be the community stakeholder representative on the Spokane Regional Board of Health.
I will second that.
I have a motion and a second to appoint Charlie Duranona or to nominate Charlie Duran. I'm never going to be able to say, I've got to say the name correctly, Duranona. There we go. To move forward to the Board of County Commissioners. Any other discussion? Seeing none. All those in favor, please signify by saying aye.
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 Aye. Motion passes unanimously. So in the third category, we have the consumer of public health. Which the candidates are Chris Patterson, Michelle Anderson, and Jeff Allen Fortin. Any discussion, or I'll look for a motion?
Well, I'll jump in here. Out of the 3 candidates, I thought all of them brought a very different perspective to this position, but the one that I was probably most impressed with, primarily because of his depth of knowledge and background with the services we provide, was Chris Patterson. I think that not only as a community member, but also somebody with some experience in some of the other federal programs that are out there that might be of help to us. He brings a tool set that I think could be helpful for the board. So I'll nominate Chris Patterson.
I will second that motion.
Okay. I have a motion and a second to nominate Chris Patterson as part of the Consumer of Public Health to move forward to the Board of County Commissioners. Any discussion? Seeing none, all those in favor, please signify by saying aye.
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 Aye. Motion passes unanimously. So the three members that will be moving forward to the Board of County Commissioners for appointment, which I believe will be next week. I'm not sure that we'll do it as by leave today. I think we'll do it next week so that way we get the resolutions and everything put in place correctly. And then they can start the month as board members. So we have, just make sure I say them all correctly. I know what I did with my paper already. Dr. Pulikani for public health, Chris Patterson for consumer public health, and Charlie Nona for community stakeholder. Those are the three names. Yes, I'm going to trip over that name. Those are the three names that will be moving forward for the three categories. So I don't know, Michelle, if there's anything you want to say to wrap this up. Oh, Commissioner French, you have a comment?
Yeah, I just thank you to my fellow committee members, board members, for your work on this. But just wanted to point out that one of the criticisms we hear from parts of the community are that the board is not diverse enough, and yet here we have appointed an Hispanic, as well as a person that's identified herself as an immigrant to this community. And then we will also have a representative from the Native American community on this board. So 3 out of 8 positions are from a diverse population and stuff. And that didn't happen as a deliberate effort. It happened because these folks rose to the top. And so I think that also says a lot about the approach that we took in going through this process. And I just want to thank you all for that. So my comments.
Thank you, Commissioner French. Any other comments before I have Michelle help us wrap up? Seeing none, Michelle, I'm going to go to you.
All right. I don't think there's anything particularly unique to wrap things up. You can take it by a motion.
Okay. Then I will look to my fellow commissioners. So I guess just the process is that these names will go forward to the Board of County Commissioners. We'll pass a resolution. They will then become board members of the Health District Board that we will start. They will be at our February meeting. And then I think Michelle will be starting the process at that point of kind of relooking at the bylaws and adjusting our bylaws to meet the new makeup of the health board.
And I have already started that project, so hopefully by your February board meeting, we'll have at least the first look at the revised bylaws, because that's normally a 2-touch type of resolution.
Very good. Thank you very much for starting that process. Commissioner Kearns?
I just want to just be certain from a logistics standpoint, just so we are doing everything correctly. I mean, true, there are 3 county commissioners here. Can we relay this information back to our clerk to prepare those resolutions? Should there be an official transmission of these names from you, Michelle, or for somebody from SRHD notifying the clerk of the board of these 3? Can Mary, as chair of the board, send an email to the clerk of the board? I just want to make sure we're doing everything appropriately and the proper steps to transmit these nominations over to our clerk of the board to get the resolutions drafted.
I think my recommendation, in light of the fact that this has been a pretty big change in the makeup of the board, and this process is new for us, is for me to do a formal letter over to the clerk, so we have something for posterity.
Wonderful. Thank you.
Thank you. And I would appreciate that, and I think that's the right thing to do. And then I guess, Michelle, you and I can work through having Anne contact the people that were, being looked at, nominated to move forward, and how we are going to discuss that with the people that did not move forward. So we can talk about that just after this meeting, so we can make sure that contact is made through the health district. Okay, so then I will look for a motion to adjourn the meeting.
So
I will move. Oh. I'll second.
I waited for you, Josh. I waited and I waited.
So it's been moved and seconded to adjourn our special meeting of February 1. All those in favor say aye. Say aye.
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 Aye. It is 11:41 and we are adjourned. Thank you all very much for your time.